Hello. 10 seconds. Hi, my name is Eric Weinhandel. Happy to have you all here today for an interesting session about infection prevention and management at home. Just to introduce myself very quickly, I'll be moderating the session today. I'm an epidemiologist. I work at DaVita Clinical Research. I have worked in the dialysis research area and specifically home dialysis for over 20 years. I had the opportunity to work on all sorts of different interesting venues, from device companies that support home dialysis to national registries to dialysis providers. Um, and really excited to have you all here today. Home dialysis is obviously near and dear to the hearts of most people who are attending today, either because you're a patient or because you're a care provider. Um, it's great in many respects. Obviously, it provides an opportunity to dialyze in the comfort of your home, but it presents some interesting challenges, right? Unlike in-center dialysis, the reality of home dialysis is that there is not a group of people around you, nurses and technicians, who have been, expertly trained in infection prevention, and so you're really in charge as a patient. You're in charge of preventing infections and making sure that when infections do occur, that they're diagnosed and treated pretty promptly, so that things don't worsen. And so that really changes the nature of how we need to think about infection for our home patients. So this session will share some best practices for infection prevention and management for home dialysis patients, both peritoneal dialysis and home hemodialysis. Um, I will say this, as far as a few key points about this, right? You know, it's hard sometimes to make comparisons between in-center hemodialysis and home dialysis. Which one has a higher risk or a lower risk of this outcome or that outcome. In general, most research seems to indicate that home dialysis is associated with lower rates of infection compared to in-center dialysis. Um, that said, it's also true that because patients are at home, sometimes can feel a little nerve wracking to talk about, I have some redness or I have some pain, and there can be delays before infections are actually treated. And so, just as much as there are lower rates of infection, there's some risk that things can spiral a little bit out of control before they're actually dealt with. This section is going to provide information on the most common infections known to occur in the home dialysis setting, signs and symptoms that patients and care partners should be aware of, as well as different tips on prevention and infection management. The thought of an infection definitely can be overwhelming. Nobody wants to think about having pneumonia or a bloodstream infection or being in the hospital receiving IV antibiotics. But this session is really going to demystify this whole topic, pull the curtain back on infection prevention, and answer some of the what if questions that people may have while they're dialyzing at home. And with that, I would like to introduce some of our panelists today. Our first panelist, I believe that I'm going to be introducing here. They're going to be coming up on the screen. All right, excellent. First face on the screen here is Yasha Rahala, and he is a dialysis technician and a patient advocate. I will leave it at that because you are better to talk about yourself than I am. So go for it and introduce yourself to the crowd.
Yes, my name is Rapa, and I'm a dialysis technician. I've been a patient for about over 20 years. I started off when I was 13. PD, chemo. I've had 3 kidney transplants. All of them failed, and I have Alport syndrome as a disease. And I do home hemodialysis now with Tableau by Outset Medical, and that's pretty much it. That's the gist of it.
Okay, cool. Well, I really appreciate giving that background. It's great that you've had the opportunity to see different modalities as far as home therapies go and different machines and stuff. I'm sure it'll provide a lot of really great background for the session today as we get into questions and answers and things.
Thank you.
Thanks for being here.
Appreciate that.
All right. Next up on our panel, let's see who shows up next. Like surprise, surprise. I think we've got a nephrologist here. This is Graham Abra. He is a nephrologist at Stanford University in California, and I will let him introduce himself.
Thank you so much, Eric, and thank you to the American Kidney Fund for having us here today to talk about this really important topic. As mentioned, my name is Graham Abra. I'm a kidney doctor and nephrologist here in the California Bay Area, where I take care of patients in the Division of Nephrology here at Stanford, in the clinic, in the hospital, in dialysis centers, And this is a great topic for us to talk about and to demystify and to make it something that you can have ownership over and ensure that you stay safe and get the benefits out of home dialysis while mitigating the potential risks of things like infections, which we'll talk about today.
All right, excellent. Well, thanks for being here. Yeah, Dr. Abra and I have worked together a little bit in the past. It's an understatement, but I can attest that he is a fantastic advocate for home dialysis and really knows his stuff. So excited to see what he's got to share today. All right, and then do we have one more panelist today, or is this the extent of it? Wasn't quite sure. Okay. All right. Very good. So we've got clearance to take off. So we're going to get into it now. Graham, I think you've got some slides today that you're going to be sharing with the group to kind of get us started off with some background.
That's right. I think that's right. We've got through the magic of technology, I think some visual aids to help us out. There we go. So maybe just to start off with a few basics. Whether you're on home dialysis or not, anyone can get any type of infection. You know, you could get a pneumonia, you could get a urinary tract infection, you could get a gastroenteritis. Just because you're on dialysis doesn't mean you can't get all the same infections that, you know, folks who aren't on dialysis might get. But there are a few specific infections that are specific to the types of dialysis that are done at home that I've kind of just popped up here on the slides, just so we're kind of familiar with some of the names of these types of infections. So for peritoneal dialysis is the dialysis that's done using the body's own natural membrane within the abdominal cavity there, where we insert a small silicone tube into the belly there, and then use fluids that move in and out of the belly, either through manual flow or through use of a machine, to move those fluids in and out of the belly and remove toxins and excess salt and water. And with peritoneal dialysis, you can get something called peritonitis. This is an infection within the belly, within that peritoneal cavity there, and it can occur because of bacteria. It can occur because of fungal type infections, and we'll talk a little bit more about it as we go through. But peritonitis is an infection within the belly for people who are on peritoneal dialysis. And then you can get a PD catheter exit site infection. So as I mentioned, PD, the way that you have access to your peritoneum is there's a little silicone tube that is inserted into the belly, and it has a little exit site out from the skin. And that little exit site can get infected with, bacteria. It can get infected with fungi. And we call that a peritoneal dialysis catheter exit site infection. The tunnel through which the catheter actually goes into the belly can also get infected. We call that a tunnel infection. So those are some of the basics, more specific types of infection that can occur with PD. And then there's home hemodialysis, another type of dialysis that we can do at home. This is a blood-based type of dialysis. And with home hemodialysis, we need access to the bloodstream in order to perform the dialysis procedure. And that access is gained either through a tunneled hemodialysis catheter or through an arteriovenous fistula or arteriovenous graft. And the catheters you could think of them like large IVs that are inserted into the big veins of the body. Typically, they're inserted into the internal jugular veins. They're large veins in the neck. And arteriovenous grafts and fistulas are surgically created accesses. They're underneath the skin. You don't actually see the access itself. You'll see you'll see perhaps a bulge underneath the skin where this access is placed. And these types of accesses can get infection. So you can get vascular access related bloodstream infections. So because these are accesses into your bloodstream, it's possible that bacteria can get into the bloodstream and cause an infection. You can also see tunnel dialysis catheter exit site infections, where the exit site, where the tunneled hemodialysis catheter comes out of the skin, can get infected, very similar to that PD catheter exit site infection that we were talking about. And then there's a very specific form of cannulation or needle insertion into our arterial venous fistulas called buttonhole insertion technique. And these buttonholes, which we can talk a little bit more about as we go on, those can get infected. It's basically a site through which the needles are inserted many times through the skin, and that little buttonhole can get infected. So to kind of summarize, if we're on dialysis, we can get all the kinds of infections that everybody gets in their day-to-day lives, but there are a few specific ones that I've kind of talked through here for PD. There's peritonitis and PD catheter exit site infections and tunnel infections. And then for home hemo, there's the vascular access related infections that we kind of talked about there. And this very specific one that relates to a specific form of needling technique into fistulas called buttonhole technique, which can also lead to certain types of infections. So that's kind of a basics there on that slide. Any questions or comments, Rafa or Eric, before we kind of move it along to the next one?
Yes. About peritonitis, I actually ended up getting peritonitis when I had my catheter when I was 13, when it was placed in. So I definitely know about peritonitis. Vascular access related blood issues. I actually, in my left arm, when I used to have my hemodialysis access in my left arm, I had a graft, and there's pieces of it still there. I had, they had to actually take it out, and I acquired staph that actually traveled around my heart. So what he's saying right now is very, very valid. And all these things happen in center, in hospital. This wasn't at home. So that's spot on, 100%.
Yeah, sorry to hear that you had to deal with these types of infections, but glad that you are here with us today to kind of talk with us about your lived experience with it, and some of the ways in which I think the important thing to know is there are ways to mitigate the risks of these things, which we'll get into. Should we go ahead?
Maybe one other question I'll ask you, Graham. Well, since you asked if we had any questions, so like all of these are very specific to dialysis. I'm guessing that we've got some people who are watching today who maybe have got family members, or maybe they themselves are approaching dialysis, but they haven't actually received dialysis in their life. So this is all a little bit confusing and foreign. What we do all know as human beings is respiratory infections. We all get them, cold and influenza and COVID over the last few years. What's your experience like in terms of respiratory infections, and how often they happen in home patients, and is it any different than in-center patients?
Yeah, it's a really great question. I mean, just to think about the practical here, if you're going to be doing in-center hemodialysis, you're going to be going to a facility where there are many other people, both people who are doing dialysis, along with all the caregivers who are there, and you're going to be transporting back and forth, either in your own personal vehicle or perhaps in a transport that has other people in it, either a driver or other patients who might be with you. So just practically, if you're doing in-center dialysis, you're exposed to a lot more people and folks when you're going out there and you're doing your dialysis. That's great socially. You can talk to people, have form relationships, all those kinds of things, but it does carry the risk of contracting infections from those people. Many of whom, the other folks on dialysis, may have recently been in the hospital, another, an infection risk environment. So certainly, as you kind of allude to here, Eric, in the early days of COVID-19, we certainly saw higher rates of COVID-19 infection in folks who were doing in-center hemodialysis as compared to those people who were dialyzing at home, where when dialyzing at home, you're doing your dialysis in your home, and you're not exposed to that large number of people that you might be if you're doing in-center hemodialysis. So I think that's an excellent point that you raise.
All right. Well, thanks for providing that perspective.
All right. Let's go ahead and move to the next slide here. I do want to just address a question that popped up in the chat around the risks of a catheter compared with a fistula in terms of infection rates. So I think it's important to understand, for home hemodialysis, if you're using a tunneled hemodialysis catheter, that catheter, although the exit site, you'll see it generally coming out on the chest wall, the actual catheter itself extends all the way into the heart. The tip of it actually sits at the junction of the big vein that enters into the heart and the heart itself. And so that tip of the catheter is sitting right there. And because it's a foreign body, bacteria like to glom on and stick to that thing. So the risks of bloodstream infection are significantly higher with tunneled hemodialysis catheters than they are with arteriovenous fistulas, which are types of access that are created underneath the skin. So they've got that protective layer of the skin that's protecting them. And before a needle is put through the skin and into the bloodstream, the area is cleaned with cleaning agents that remove bacteria so that you really keep the risk of a bloodstream infection down. And that's borne out in the data that folks like Eric have worked on over the years, that we see far fewer bloodstream infections when we look at arteriovenous fistulas versus tunneled hemodialysis catheters. Anything else you'd add to that, Eric?
Yeah, I think that's right. I think we have so many studies from so many different countries and across both home and in center that it's pretty hard not to think that catheters put a patient at a higher risk of an infection. I think that that's probably pretty true. Now, the one thing I will say with home hemo is that, when you look at the history of home hemodialysis over the last 15, 20 years in the United States, as the therapy has grown and spread across the country, people come to home hemodialysis at various points in their dialysis journey. And sometimes we have really new patients who they've just been diagnosed with kidney failure. They start home hemodialysis. For that patient, I think that the approach should be similar to an in-center patient. They may start with a catheter, but we should be trying to get patients to a fistula or a graft. There are other patients, there are actually a lot of patients who have encountered home hemodialysis after spending several years in the dialysis facility, dialyzing in center. And some of those patients honestly have got, veins, arteries in their body that have some disease. And after 3 or 4 years of dialysis, having a catheter may make the most sense for that person's body. And for that group of people, I don't think that anybody should think I can't do home hemodialysis because I have a catheter and because I don't think I'm going to have a fistula in the future. Home hemodialysis can still work with the catheter. You just have to be careful. So again, I think it's kind of both sides. It's let's promote, let's be all on the same page. It's better to have a fistula or a graft in most cases, but don't think that you're not a candidate for home hemo because you have a catheter.
Absolutely right. Yeah. So on this slide here, I've outlined some of the signs and symptoms of peritoneal dialysis related infections, some of the things you might experience if one of these specific PD related infections showed up. But maybe before kind of going to what's on the slide there, Rapa, you had mentioned that you actually have had peritonitis. Maybe you could talk about your experience with that and what it was like for you.
Uh, Geez, I remember that was really a long time ago, because the procedures for putting in the catheters for peritoneal dialysis, they've changed over the years. Now you go to your vascular clinic and they just they do it. It's very quick. It's very simple from what I've seen. Back then they actually cut you open and they put it in there and they did what they had to do. So what happened with me was post surgery, my catheter ended up intertwining with my intestines, and then they had to unravel it. It wasn't working, and then that's how I ended up getting peritonitis / E. coli, and it was painful. It's very painful. When you get peritonitis, you catch fever, experience abdominal pain, and just many days in the hospital. That's what I remember. I mean, because it's so far back. I was 13. I'm 36 now. But that's definitely not an episode that you would want to undergo. Always keep your stuff clean, of course. And as far as peritonitis goes, that's pretty much it. Now, all I remember was that it was very painful, very painful. Them draining out the blood, getting antibiotics, having to be in bed, and just looking up and just thinking like, when is this going to end? But eventually, things cleared up, and I ended up getting transplanted like a month later. So, it works out eventually.
Thanks for that, relating your experience there. I mean, it sounds like you had an incredibly severe case of peritonitis associated with the actual catheter insertion procedure, which absolutely can happen. Um, Many folks, if they do get peritonitis, it happens after the catheter insertion, after some time where they've been on peritoneal dialysis at home and are performing the procedure themselves. But certainly, as you describe, it can happen with the catheter insertion. Now, on the slide, I got some of the symptoms that can show up with peritonitis and other types of PD related infections. So for peritonitis, as you mentioned, belly pain, it's an inflamed peritoneum. If you're doing PD, you may see that the drainage that's coming out of the belly, the effluent, that's just what we call the fluid that's coming out of the belly while you're doing PD. It may get cloudy, filled up with white blood cells because of that inflammation that's happening in the belly. Other systemic kinds of symptoms, nausea, sometimes to the point of throwing up, fevers. These types of things can show up when one develops peritonitis. I think it's important to highlight, though, that in many dialysis clinics, first of all, you're not going home until the nurses are 100% confident that you are going to be successful at home and that you have learned the techniques to take care of yourself in a way that's going to really limit the chances of getting a peritonitis. So no one's just sort of sent home and good luck with that. This is something where you're doing excellent training with the home dialysis nurses. You're really learning about good hand hygiene, aseptic technique, how to connect and disconnect to the PD catheter in a way that's really going to reduce the chances of peritonitis occurring. And then once you do go home, the rates of peritonitis in modern home dialysis clinics generally are pretty low. In some clinics, you might see rates around 1 in every 5 years. You'll see a peritonitis case if you average it across all the patients that are in the center. So peritonitis is something that absolutely does happen, but with excellent training, good technique, it's something that the risk of which can definitely be reduced. There's this question here before I kind of go to those other types of infection, maybe for us just to think about infection. The thought of infections can be a pretty intimidating one. And I think it's important for us to think about how do we reduce that fear, that sense of, gosh, I really don't want one of these. How can I think about this so that this potentially is something doable for me? Maybe Rapa, Eric, you guys could comment a little bit on how you address the intimidation factor.
Yeah, Rapa, go ahead. I think your perspective is most important.
Oh, thank you. The fear part, the fear part is, and it's inevitable, but it's something that I myself have had to overcome, because when I would go into surgeries or for all the surgeries that I've ever had, it was never me being like, oh my gosh, this is all going to happen to me. Woe is me. It was never that. That was never truly a hurdle for me. The actual fear actually drove me to be clean. So all of the infections that I've ever gotten were, because I've only had 2. I've had 3. Excuse that. I've had 3. So the infections that I've had, they were all in medical facilities, or like you said, it was surgical. These were things that I couldn't prevent. You know what I'm saying? So on my end, I know that I'm doing everything it is that I can to keep myself sanitary. Like, my apartment's always clean, everything's always clean. But for the most part, I guess what I'm saying is that when you transition into medical care And nothing against the teams, you know, it's not their fault. There's certain things that really are out of your hands. And with that, you have to take it with a grain of salt. You really got to take it with a grain of salt, because nothing is absolute. Nothing is perfect. We just go based off of what we know we can do at that given time. So as far as fear goes, you just have to accept a certain amount of uncertainty. But at the same time, just understand that you were capable of being accountable for yourself, because I push that with patients all the time. You have to be accountable for yourself. So make sure you're accountable for yourself, but just accept the uncertainty that these are the possibilities. Just like when, you know, you're a doctor, you come through and you give them a pill or something like that. Okay, these are the side effects that might happen. This may happen, that may happen. It's not a guarantee that that will happen to you, but nonetheless, it's something that you may want to keep in mind just in case. So it's really not a fear thing, because I know sometimes I come off and I'm just like, I don't even want to touch that. But that's because in the back of my mind, I know what can happen because of what I've been through. But really, no fear. It's really not a fearful thing. It's more of just a cautious step, I would say, when I step into these situations. It's a cautious step, you know, prudence, if you will.
Yeah, no, I really
Healthy
appreciate that
respect.
perspective. I think your perspective, Rapa, is great. I think that, you know, to put this like in a historical sort of perspective, you know, the frequency that we see peritonitis occur in PD patients today is half, 60% lower than it was a generation ago. And that just goes to show that there is a risk here that we can control. Now, it's not to say that you can prevent every infection from happening. That's never going to happen. It doesn't happen in any human being, whether they're a person with 2 functioning kidneys or no kidneys at all. But we can control this, and it comes down to how we set up machines and how we take care of our catheters and our access. And so there's something that you can do here as a patient, as a care partner, and your care team can do as well, to help mitigate this risk. And so, you know, that feeling of control hopefully provides a little bit of comfort, against the understandable fear. The other thing I would just add is that, and there's been some interesting studies over the years about like, how long it takes to get antibiotics into a person who has signs of infection. And I would just emphasize over and over that every hour counts. When there's an infection inside your body, every hour counts before you start an antibiotic. There was a study done in Australia years ago about the number of hours between the symptoms starting and when the antibiotic started in a PD patient, and every hour counted in that study. And the longer you delay, the worse things get. So, as hard as it can be to admit, and trust me, I'm a middle-aged man, I don't like admitting my own health problems, but every time that you see a sign or a symptom of an infection in your own body, tell your care team, tell your nephrologist, tell your nurse, because getting treatment as quickly as possible does make a big difference.
I think that's such an important point, Eric. And I think many of us are conditioned to kind of feel like, I'm okay. I don't want to bother. I don't want to bother my nurse, my doctor with this thing that maybe it's going on, or maybe it's not, or I've got this thing, maybe it'll just go away. I would just encourage everybody out there. We are here as physicians, as healthcare professionals, as nurses, to take care of patients, and we are not at all bothered when someone calls with whatever the symptom is, to help that person out and get to the bottom of it. Is it infection? Is it something else? I think it's better to be safe than sorry. If something's going on, it's a little off. You know your body best, and if there's something different that's going on from what usually goes on, it's really helpful to connect with the care team and get it understood as to what that thing is actually being caused by. Because as you say, Eric, if it is an infection, let's get it knocked out early,
Yeah.
so we don't end up with something that's really severe, like Rapa was kind of describing with his early PD catheter insertion experience. Because oftentimes, if we can get those antibiotics in right away, many cases of peritonitis, which we were just talking about, they're treated outside the hospital. They're treated at home with antibiotics that are put into the belly. So
Yeah.
lots of good opportunities to treat things quickly and early, if you overcome that sense of, gosh, I just don't want to bother my care team, which I have myself when I'm talking with my own doctors, and it's an important thing to check when you have that instinct to, I just don't want to get in touch.
Just want to encourage people who are connected right now, please feel free to continue putting questions in the Q&A. We'll try and process them as much as possible. We still have about 15, 20 minutes here together. So we'll keep going through your questions and answering everything the best we can. We actually have a very interesting one. I know I've heard it many times over the years, but it's near and dear to many people. They don't just live with humans, they live with animals, cats, pets, gerbils, you name it, birds. So, I want to do home dialysis, but I have a pet in my house. I have lots of pets in my house. Is it okay? Bram, you want to start off with that one?
100% it is okay. We want people to enjoy their lives. We want people to have their companions that they have in their homes, whether they be humans or animals, reptiles, birds, etc. All these things are important to us as people. I think as kind of as we've been talking about, the key is we need to understand what additional risks might be introduced by having a pet in the home. So this goes back to really good training during your time training with your home dialysis team. You can have a pet in the house, but you usually want a room where you can keep the pet out while you're doing the dialysis itself, because pets can get mixed up with the equipment. They can get mixed up with the different supplies that you've got when you're doing dialysis, and you want to try to reduce the chances that the pet is going to contaminate anything that might put you at higher risk for an infection. And this has actually been looked at in the specific case of peritonitis. There's a very large consortium of dialysis centers across the globe that put information and data into a very large system called the PDOP system. And they recently looked at this in terms of peritonitis risk if you have a pet. And if you've got one pet, it does not seem to increase the risk of acquiring peritonitis significantly. Now, if you've got multiple pets, it did seem to bump that risk a little bit. Again, kind of speaking to the fact that if you do have pets, you want to know your best practices in terms of reducing risk of infection while you're at home.
Yeah, that's very helpful. Do you have any experience in terms of, obviously you've managed lots of home dialysis patients over the years, cared for them. Is there any meaningful difference between dogs and cats in the home? Things you would watch out for more with one than the other?
Yeah, that's a great question. I'm sure Rapa has perspective as well. From my personal experience, cats seem to like the warmth of the PD cycler.
Oh,
They seem to like to go up and sit on there. It's nice. It's a warm little cozy spot that they can snuggle up to. Um, and they also tend to like dangling lines. So they like to, cats like to bat at things. uh, so that's a couple of things that are kind of specific to cats. Um, Rap, I don't know what your experience has been, if you've had pets during any of your time on home dialysis, and whether there have been specific experiences that you've had with them.
No, I haven't had pets for that specific reason, and I'm glad this is coming up, because I have to reiterate this, because some of the patients that I counsel might be watching. You cannot have your patients by your treatment floor. You cannot be on treatment and have your pets with you. I get it, you know what I mean? You got your cat, and then your blood, whether you're on peritoneal or you're on hemodialysis, and you're just there and you're petting your cat. They take pictures, they put them on Facebook, they put them on Instagram, like it's a mess. And it's like, it's great, you're living on your own terms, but hey, infection, people, I'm also a professional, so it's like infection control. Let's remove the pet from the area. Do what you got to do. Take care of that. Bring your pet back. I know that we may need service animals and so on and so forth, but don't keep, for the love of the Most High, please keep your pets out of your treatment area. because they, regardless if they're with you and they don't go outside, whatever the case may be, they still have diseases or whatever it is that they have inside of them, their hair, whatever it is they carry on their hair, especially if they shed a lot. There's so much that can happen. Something can get in the line, or let's say you're disconnecting, all right, and then the hair's in the air and it just flies in. It happens. I'm not saying that it's gonna happen, but it can happen. Have your pets, do what you will, but when you're treating and when you have your supplies put up, keep your supplies sterile. Don't have your pets near your supplies, your machine. That is a no-go zone. Because you know how people are. They like to let their pets rule the house. Oh, my dog and my cat. They're like, that's my human. I don't know how that goes. You know what I mean? Me, I'm the owner. You're here for me. I come and get you when I need you. Then I put you away when I gotta go do my thing. You get what I'm saying? Like, let's keep it kosher. How about we do that?
That's good advice. It's definitely good advice. It is no question that mixing organisms, whether those are humans and animals or whatever it may be, there's always more risk than if they're separate from each other. I mean, we don't generally see like comfort animals in the operating room in the hospital. We keep them to patient rooms when we have animals in the hospital. So it's always good to be careful for sure.
Yeah.
All right.
I was just noticing
Yeah.
that we got a couple more questions that have
Yep.
popped up in the chat there. There's a question here around symptoms of bloodstream infections for home dialysis. These are ones that we would more commonly see with home hemodialysis. Peritoneal dialysis, peritonitis rarely results in bloodstream infections, but we do sometimes see it in home hemodialysis. And oh, there you go. I'm aided by a slide. Ask and you shall receive. So there you go. So home hemodialysis, bloodstream infections, you can see things like just not feeling well. Medically, we call that malaise, not feeling great, just you're feeling off, fever, nausea, throwing up, low blood pressures. All these things can be signs and symptoms of bloodstream infections, chills, body aches, these types of things. If you're feeling off, if you're not feeling good, again, this is another one where don't be shy about contacting your care team to let them know, like, hey, I'm feeling this way, and there are tests that can be done, medications that can be given, empiric antibiotics if there's a high suspicion of a bloodstream infection that can help to treat those things if they're popping up for you. Rapa, I don't know, you had mentioned that you had quite a severe bloodstream infection. Do you want to talk about perhaps your experience with it? What types of things you felt?
Sure. Geez. When I had gotten that infection, I didn't even know. That's the weird thing, because normally when you're in center, if you have like a little bit of staph or something like that, get into your bloodstream, and then you start feeling it once you get on the machine, because your blood starts spinning and then everything's circulating through your body. The doctor will come in or the nurse will take the order, and then you get vancomycin. That's what they normally order at the clinic, and then you feel better, and then you go home. But in my case, it's like it was dormant. It was very strange. Like I would have a fever, it was low grade, and then I would feel lethargic, I would feel kind of weak, and I thought maybe I should just take this and take that. And this went on for about a period, I think, of about a week.
Yeah.
And I would keep getting myself admitted into the hospital, but it was weird because they weren't finding anything. Well, eventually, I was at dialysis and I almost blacked out. I almost passed out. I started losing consciousness. And that was towards the end of my treatment. They got me, they took me to the hospital across the street. They ran some blood tests, and then that's when I found out that I had staph. And it had gotten, it was at my site. It was literally at my site. But the problem is that the normal the norm that you would find in an infection, like as far as like redness, swollen, puffy, tender, you know, it wasn't, that wasn't the case. When the needle went in, everything circulated, everything was fine. I thought everything was cool. I thought I was gonna be able to go back to work. And that just got that infection going. That's exactly what got that infection going. And I just remember that, you know, my body was just really, really lethargic, full of fatigue. And that's when I found out. They told me, they said, you know, we're going to tell you in 3 days' time whether you have staph in your heart or around your heart. And so I waited for 3 days, and then they told me it's around your heart. So we're going to take care of it. Had it been in my heart, I wouldn't be here right now. You know, so all praise be the Most High for that. But and mind you, to the patients that are out there, people who are watching this, your case isn't going to be mine. You know, off top, it's not going to be yours. This isn't you. This is something that I went through. So you know, you may experience the regular symptoms. You may not. You know, you may just end up going to the hospital, and then you might just end up finding something. So it's not something to be fearful of. These things do happen. But I do wish we would have caught it a little bit sooner than what we did. And me just not trying to tough it out. There was that. And then there was the one that was in my right thigh. There was another one that I had during COVID. This was post my third transplant that didn't make it. My third transplant didn't make it. And they were operating on my right thigh graft because it needed to be operated on. Well, they took a piece out and they put it in. And then somebody ended up putting the stent a little too high on the arterial side. And I know I'm speaking, you know, Chinese to some people, but you'll get it as you go along. So what ended up happening was that part of the graft, for some reason in the hospital, it ended up getting infected. And so they had to go in, remove it again. I felt the fever. I kind of felt lethargic. And it was immediate surgery. It was antibiotics and surgery. You know, the number one thing is if they can't get it out, especially if you have like a graft or something like that, the best thing to do is to get it out. Get the piece that's infected out, or maybe if it's on top, because that part on top of the graft was infected. And it was weird because it wasn't affecting any part of my body, which was weird. It wasn't infecting the graft or anything like that. It was very, very strange how like my infections came about. They were very abnormal to me, you know, because with my medical background and stuff, it's like an anomaly. I'm like, well, how did this happen? How do these things happen? Can we take care of them? So a lot of surgery does take place. And I think that's about it. I think that's about it. And I hope people were able to understand that, because, you know, we only got so much time, and I'm trying to lay down the facts. You know what I mean?
Yeah, definitely. Yeah.
I think your descriptions were really actually excellent, because a lot of what you described, sometimes when infections are beginning, we attribute them to something else. We say, I'm just a little tired. I'm just a little achy. It was a fever, it came, but then it went. I think it highlights the point that we brought up earlier. Anytime one of these things pop up, reach out to that care team so that we can get it sorted out. Maybe we could move along. We've only got I think 5 minutes left. I think to kind of wrap things up, we want to think about some of the best practices, some of the tips for folks who are considering on home dialysis or on home dialysis and their caregivers, and some of the things we can do in terms of preventing infections and taking care of them. I think a key that's kind of come out through the presentation here is really, engage and learn from your caregivers, your nurses, your physicians, your technicians, all the people on the care team, and ask them questions whenever you're unclear, because that little thing that you learn from that caregiver may be the thing that prevents the peritonitis, that prevents the bloodstream infection. So I think that's key. There are no bad questions. Whenever they pop up, whether it's in training or during a monthly visit, ask the question, because I can guarantee if you've got the question, there's probably 10 other people in the clinic that have the same one, and if you can highlight it for the nurse, for the doctor, then they can bring that information to other folks who are doing home dialysis. I think that's sort of a key one. I think we've touched on a lot. When in doubt, just call. Yeah, give a call. If you're worried about an infection, you're feeling a little off, there's a fever that came and went, it never hurts to give a call to the care team. They're not going to be bothered by this. This is something that we want to know about so that we can help you with it. And there's lots of tips and tricks that the care team is going to be able to provide you with in terms of preventing infection, PD catheter exit site infections, peritonitis, bloodstream infections, all these things. There are multiple techniques and approaches that you can learn about when you're learning about home dialysis or reviewing it regularly that can help to keep you safe at home. And regularly reviewing those things, refreshing your knowledge, seeing if there's anything new, I think can be really helpful in terms of preventing an infection when you're on home dialysis.
Yeah, and I would just add a few things. I mean, most patients who are on home dialysis are going into the clinic once a month, maybe as infrequently as once every 3 months. But when you go to the clinic, if you've got, questions about whether you're doing the right thing or not, just take the time to demonstrate. Ask your nurse and say, I'd like to show you how I'm preparing for the dialysis procedure each day. This is what I do. These are the steps I go through. And that gives the nurse a chance to get their eyeballs on what you're doing and if anything has changed in your own behavior. And so it just gives that constant chance to sort of recheck, retrain as time goes on. We all definitely, all of us humans, our tendencies kind of change and fade. And to that point, I think that the other thing I'd encourage everybody to remember is that none of us want home dialysis to ever feel like a prison or like you have to do this over and over again. But that is what you have to do to prevent infections. You have to be careful over and over every dialysis procedure. If it feels like it's too much and you need a break, tell your team. There's always the opportunity to dialyze in a dialysis facility for a period of time and get a break, get a chance to get away from the routine. You can go back home after you've sort of recovered, recuperated, feel like you've had that break from the usual routine. But it's important to take breaks. It's far better to go in center for a few weeks and get a mental break from home dialysis than to continue to do the wrong thing or to break down and not wear gloves or not wear masks and do things that'll risk infection. All
Absolutely.
right.
Great points.
Yes.
Well, we are just about winding up here. So I want to encourage, I guess, give both of you a chance to sort of any closing thoughts here on our session today. It's gone fast. Rapa, you want to go first? Any parting wisdom for our attendees today?
Yes. Wear your gloves. Keep your lines out of your mouth, people. I'm talking to the patients that are on dialysis. Keep your lines out of your mouth, especially you solos that are on next stage. Keep your lines out of your mouth. I see you. Don't do that. I know you're winging it. I get it. Stop that, please. It gives me anxiety.
Good tip.
And stick to your tools. Like they said, stick to your knowledge, stick to your tools, and pray and hope for the best. That's all we can do. Stick to your tools, stick to your knowledge, and pray for the best.
Great advice, and don't chew on your lines. All right, and Graham, any parting wisdom from you?
Dialysis is something you can do. Infections are a risk, but they're a risk for all of us, and anything we do carries some degree of risk. And with good training, with learning from your care team, it's something that absolutely can be safely and effectively managed at home. So these are important things to educate yourself about and know about, but they shouldn't be things that prevent you from benefiting from all the things that you can with home dialysis.
Yeah. And I would just say as a parting thought, always remember that the reason that we are so supportive of home dialysis is because it is very good for your heart. And our bodies require all of our organs to work. And preserving your heart health is one of the most important things you can do when you're a person on dialysis or waiting for a transplant. And so the value of home dialysis is very obvious. And it's just a matter of managing some of these risks on the side. But infection should never be seen as something to be afraid of or some reason not to do home dialysis, because that is definitely not the right way to think about all of the organs that we're trying to take care of here. So just want to appreciate again everybody for attending today. There's going to be another session coming up at noon Eastern time, 11 Central, 9 Pacific. That is a cooking demonstration lunchtime with the cooking doc. So please tune in for that in about 8 or 9 minutes or so. I'm sure there'll be a thrilling session filled with some great information about food options. And with that, we will bid you all adieu today. Hope you all have a great day, and look forward to seeing you at a future AKF seminar. Thanks.